This is a lecture on the joints. Okay, lecture 6 on the joints, based on Martini's chapter 8, some learning objectives. Drawing assignment, shoulder joint and knee joint. And now on to joints. So there are over 200 bones in our body, and with the exception of the hyoid bone, they all articulate with other bones at joints. Joints include the bones themselves, the cartilage on the end of the bones, and ligaments that hold together the bones, and often other accessory structures, which we'll learn. Bones in joints allow bones to move in relation to one another, and joints also help to control the movement of the bones so that they don't become misaligned while they're moving. There are two very important characteristics of joints, and they are the range of motion of the joint, or the mobility of the joint, and the stability of the joint. Range of motion and stability are inversely related. For example, the shoulder has the greatest range of motion of any joint in the body, and it is also very unstable and prone to injuries. The skull has suture joints that have almost no range of motion, and this gives the skull great stability. Okay, the classification of joints, and this is the most general classification here. Joints can be classified either by structure or function, that is, by their range of motion or stability. And these two things, their structure and their function, can be put together into different systems of classification. So in this lecture, I'm going to classify joints first by their structure, and then I'm going to discuss their range of motion as a characteristic of their structure and put the two together. This is a common way to do things. This is a page from the anatomy coloring book, and you see here that we have three different types of joints: the fibrous joints, cartilaginous joints, and synovial joints. And then that's the structure of the joints. And then underneath, we have written down here their range of motion. And for the fibrous joints and for the cartilaginous joints, the range of motion can be basically none or immovable, or they can be partly movable, but they're not ever freely movable. Whereas synovial joints are always freely movable. So, just explicitly out here, I have written out for you structural classification of joints: fibrous, cartilaginous, and synovial, and then functional classification of joints: immovable, partly movable, or freely movable. And again, as I said in class, you don't have to learn the special anatomy words for a joint that's immovable, partly movable, or freely movable. I just put those down there for just letting you know they exist in the universe. Okay. The fibrous and the cartilaginous joints that are either immovable or partly movable only are more common in the axial skeleton, which makes sense because we need greater stability in our axial skeleton, which, remember, includes the skull, the vertebral column, the ribs, and the sternum. And we don't need a whole lot of range of motion in the axial skeleton, but we expect all of those components of the axial skeleton to provide a stable center from which we can move the appendicular skeleton. And sure enough, synovial joints, which are considered freely movable, are more common in the appendicular skeleton. So synovial joints are found from the shoulders to the fingertips and from the hips to the feet. And they provide greater range of motion, but the trade-off is that they have less stability and more prone to injuries than the joints of the axial skeleton. Okay, so fibrous joints. First, fibrous joints are usually composed of dense, irregular connective tissue, but they may be composed of dense, regular connective tissue. There is not such a clear dividing line between the two types of connective tissue always. Because remember, dense, irregular connective tissue has bundles of collagen fibers that are oriented in just kind of a patchwork of directions, creating a kind of mat of dense, irregular connective tissue. Whereas dense, regular connective tissue has bundles of collagen fibers arranged in parallel to each other, but it's not always a complete and total difference between the two types of connective tissue. Sometimes there can be in-between cases. So, as mentioned earlier, the fibrous joints are either immovable or only partly movable. And overall, they are quite stable. And now we're going to give an example, and I'd like you to memorize the example also. So, an example of an immovable fibrous joint is the sutures of the skull. I'd like you to remember that one. Sutures are only found in the skull. And remember, during development, they are composed of dense, irregular connective tissue. And when we're born, our sutures wider, and there are actually spots in the skull of a newborn baby that are just sheets of dense, irregular connective tissue, and those areas are called fontanelles. There's a large anterior fontanelle, and there's multiple other fontanelles, but the most important one is the anterior fontanelle. And they're very important. They allow for molding of the baby's head during delivery, and then as the baby grows, they allow for growth of the baby's skull. With age, sutures in the skull may turn to bone, or they may stay dense, irregular connective tissue. This is not agreed upon by all sources, what exactly happens, and perhaps it is different in different individuals. Okay, so now partly movable fibrous joints. The example I would like you to remember is the interosseous membranes between the bones of the forearm, the radius and the ulna, or of the leg, the tibia and the fibula. The interosseous membranes are just broad sheets of dense, regular or irregular connective tissue. They act as attachment sites for muscles, and the flexibility of the intraosseous membranes is greater in the forearms than it is in the leg, which makes sense because our radius rotates over our ulna in order to go from a position of supination in anatomical position to a position of pronation. And there needs to be flexibility so that the radius and the ulna, which are attached to each other, can still move in relationship to each other. On the other hand, in the leg, that does not happen. There is no supination or pronation, and the connection between the tibia and the fibula is much tighter than it is in between the radius and the ulna. How is it that the interosseous membranes are different? Well, the interosseous membranes in the forearm have longer collagen fibers that allow more movement, whereas the interosseous membranes in the leg have shorter collagen fibers that allow less movement. Okay, cartilaginous joints. So cartilaginous joints are composed of either hyaline or fibrous cartilage. They have either no mobility or partial mobility, and they're stable joints. So our example of an immovable cartilaginous joint is the epiphyseal cartilages or epiphyseal plates in developing long bone. The joints are in there connecting the diaphysis to the epiphysis of the bone, but we do not expect them to move in relation to each other, all right? Or the epiphysis would become dislodged from the diaphysis, and that would be extremely disadvantageous for a bone and very painful. All right, so as we learned, the epiphyseal cartilages are hyaline cartilage, and then they're being infiltrated over the course of development by spongy bone, and eventually the epiphyseal cartilages are actually completely infiltrated by bone, and at the time of epiphyseal closure, which is the time of puberty, they become the epiphyseal line. Now, partly movable cartilaginous joints are composed of fibrous cartilage with many collagen fibers. They are a strong type of joint, but they're also compressible and slightly flexible. And these joints can act as shock absorbers. The two examples that we have already learned without knowing it were the intervertebral discs and the pubic symphysis. The intervertebral discs have an outside that they have a superior surface, an inferior surface, and then a rim all the way around in a circle of fibrous cartilage, but inside is the nucleus pulposus, which is a gel-like substance with a ground substance in it as well as fibers. And that actually is not fibrous cartilage, but the whole intervertebral disc is still considered a cartilaginous joint made out of fibrous cartilage. And then the pubic symphysis is just fibrous cartilage. There's no, gel-like filling. And that's the other example of a partly movable cartilaginous joint composed of fibrous cartilage. And interestingly, both the intervertebral disc and the pubic symphysis are found in the midline of the body. Okay, so on to synovial joints.